Greetings! Welcome to Tips and Tricks for Nursing Educators, Designing Learning that Mirrors Practice, the Clinical Judgment Measurement Model in Action. So the NCSBN developed an evidence-based framework for defining and measuring how nurses think in clinical situations. Hence, we have the Clinical Judgment Measurement Model that you can see here. There are 6 steps to that model: recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. This model is the cognitive backbone of the next-gen NCLEX, which launched in April of 23 and is now fully embedded in the 2026 test plan. Now it's not considered next-gen NCLEX anymore, it's just the NCLEX because this is what we have. When faculty say to me, well, I don't really use this model because I feel like it's throwing out ADPI or the nursing process as we know it. It isn't. If you think about it, this is really a way to add precision to how we describe and teach clinical reasoning. Hence, the doing, which is the step that follows clinical judgment. You need to think of it as an upgrade in language, not a replacement of values, of what we value in nursing education and then as practitioners. When you walk the 6 steps with intention, as you see here, students are going to, and you scaffold these throughout your curriculum, students are going to have a very solid base on which to make decisions when they get out of school to keep their patients safe, even while they're in school. In clinical courses, you can scaffold this so students become more and more adept at each one of these steps. And by the time they get done in your program and they graduate, they'll have a firm foundation upon which to build more clinical judgment and better critical thinking. But we want them to be able to do that when they graduate. This has not replaced the nursing process, but has enhanced it. I just think that we need to think of ways that we can start students on the path of recognizing cues. From the very beginning, whatever body system you study first, use pictures, use case study vignettes, use Socratic questioning in the classroom, ask questions about their reading assignments, ask questions about pathophysiology and how it relates to the body system and the disease processes that you're studying then. And you can work the nursing process and the clinical judgment measurement model into that by asking questions. You want to be able to see in time how your students are thinking. And that's why I love Socratic questioning so much and using the terminology that NCSBN uses. This really does link theory with clinical. Here is the embedded clinical judgment measurement model with ADPI. So you can see they fit there very nicely together. What we know is that new nurses are entering practice without adequate clinical judgment skills. The research shows that only 9% are ready to practice safely at the bedside after they've passed their boards. That's 3 out of a class of 30. So we have to change how they think so they can do the right thing. So, this makes the exam stakes concrete. They now get 18 mandatory clinical judgment measurement model based case study items on a partial credit scale, and students can't avoid it, and neither can we. This shifts the frame from threat to opportunity. This is our chance to align how we teach with how clinical judgment is actually measured. That's alignment, not additional burden. So some integration strategies you'll see here. Make sure that you're using clinical judgment measurement model language. Use unfolding case studies, adapt them, redesign simulation to bring in the clinical judgment measurement model steps, and then do traditional exam questions with your students in class, but also do NGN style items and walk them through how to answer those types of questions and how to think, what they would do. I thank you for your time. you do incredibly important work for nursing students and for the patients that they're going to be taking care of in the clinical setting. Your students' clinical judgment starts in your classroom, and it has a framework. Let's build clinical judgment in our students together. Thank you so much for your attention. Bye now.